Hello, and welcome to Franklin County Home Health Agency's Where the Heart Is, our monthly show that brings to the public information about the programs and services that we offer, as well as tips to stay healthy and well. My name is Janet McCarthy, and I'm proudly the Executive Director of our organization. With me today, I have two guests, Jennifer Archambault from the town of Fairfield and Hank Lambert from the town of Swanton. Welcome, and thank you so much for being with us this morning.
Thank you.
Thank you.
I wonder if you could start by telling us a little bit about your organization, or who you are and how you got involved with Franklin County Home Health and why you're here today.
Well, I'll start. I've been involved with the Franklin County Home Health as a board member. I just got off the board, and I've also been a hospice volunteer. I have about 15 years of hospice volunteering under my belt, and it's one of the most rewarding work that you could do. I'm very impressed with the staff of the Franklin County Home Health. You're professional, do excellent work. There's a lot of compassion, and the board as well is very active. So. I've just really enjoyed the relationship with Franklin County Home Health, and want to do all I can to support it.
Thank you, Hank. We really appreciate your support. How about you, Jen?
Sure. So I have a very long history with the organization, starting back when I was a child. My grandmother had volunteered on the Home Health Council and had a loan closet on her back porch, and I remember having vehicles driving up to the back porch to load up hospital beds or wheelchairs or crutches or whatever was needed to help their loved one recover at home. And then in later years, my family needed services after my grandfather had a debilitating stroke, and my grandmother took care of him for 7 years. Really single-handedly, and would not have been able to do that without the nursing and LNA services from Franklin County Home Health. And then most recently, which is really, and then in later years, I took birthing education class and received lactation support and had experience with hospice with my grandfather. And then most recently, as it relates to my community in Fairfield, we had taken care of my husband's grandmother while she was on hospice, and really could not have done that work without this agency. It really seemed impossible without the work of this agency and really wrapping around our family. Grandma Jane, as we love to call her, did not have a living spouse, did not have any living children, so it was really the grandchildren that really wanted her to have this amazing life at the end. And we were able to do that with your help, and it was really, I just can't say enough wonderful things about the organization. And I happened to work for you for 6 years. So it kind of all comes full circle for me.
It sure does. So I think, you've got a really strong theme about the importance of our organization within the community. And I think that's part of what really is a significant asset to us. Back to the early days when your grandmother had the loan closet, it's neighbor helping neighbor. And your grandmother would be really surprised to know how much we've grown since then.
Absolutely.
We served 2,000 people last year. We made 75,000 visits to the residents of Franklin County, some in Lamoille County as well, with a special maternal child program that we have. Our staff is now 175 employees, driving over 500,000 miles to meet the needs of our community. And it's really just pretty phenomenal about where our agency has grown since its very early days in 1969.
Sure, and I think that people know and understand about the care. What I want people to understand is the total value that's provided. Yes, it's exceptional clinical care, but there are so many supports in place for families, whether it be having a really difficult conversation as a family about end of life and topics that people are generally uncomfortable with, or waking up in the middle of the night and realizing you forgot to give the last pain medication dose for your loved one, and you call and no one is somebody's answering the phone and saying, oh, it's no problem, that's what I'm here for, I'm here to help you. So it's really what I want people to understand is the total value, and it's really those wraparound supports of care. And it's not just caring for the person who is ill or at the end of their life, but it's really about caring and supporting the whole family.
Yeah, so we take care of, young people, we take care of older people, we take care of people that are wealthier than others, we take care of people who, struggle to get food on the table. So we really take care of our whole community. And we couldn't do it without our community support. And we have town meeting days coming up, and we ask each of our towns to support our organization through an allocation, either through their budget process or through their voting process. Every town's a little bit different. And Jen, I'm going to ask you, Fairfield's been a longtime supporter.
Sure.
Can you tell us a little bit about what happens in Fairfield and
Yes.
why Fairfield supports our organization?
Yes, absolutely. I think that we, in Fairfield, we actually have a voting process, and so it starts actually in December, January. I get an email saying, we have a petition, can you get signatures for us? And so a number of community members work collectively to get those 65 signatures so that then the requests can get warned and be part of the voting process in Fairfield. And my favorite story happened while I was working for Home Health and represented the agency at town meeting, which I still do, and a woman got up and said, well, why are we only giving them this amount of money? Why don't we give them more? And I remember coming back to you and saying, okay, we have to ask this community for a little bit more money. There's a lot of support in this community, and people are really behind this agency and really understand the impact. And there is never, in the 10 years or so that I have been representing the agency at town meeting, that's the only time anyone has ever gotten up and spoken, and it was in full support and to give the agency more. And I think that's really says a lot about the Fairfield community. And in thinking about my own experience, the way that I think about it is with my husband's grandmother, with Grandma Jane. She was at the center. We wrapped around her, Franklin County wrapped around us, and then this community that loved her, loved us, and loved this agency completely wrapped around us, and really provides not just support of meals or kind words or cards, but they stand up at town meeting and provide their support as well financially.
Well, every town in Franklin County contributes now. We're very, very appreciative of that. Highgate has been very thoughtful about their requests, and this year we're doing a little bit of a different process at Select Board's recommendation, and we've petitioned Highgate as well, and we are on the warning, having successfully obtained the number of petitioners that we needed for that. And thanks to give Hank another shout out, because he also has family in Highgate that was very helpful with that. So we really understand that the towns have some budgetary constraints as well, and the select boards or the alder people or councilors or whatever they happen to be in the towns have been very diligent and thoughtful about their charitable support, and we value that and appreciate that and really want to work with them. Hank, I'm going to turn to you and ask you to talk a little bit about Swanton, because we'll also have a vote in Swanton as
We
well.
do. Over the years, Swanton has been very generous supporting Franklin County Home Health. They level funded for many years, at least 12 years, I think, to the tune of around $9,000 plus. This year, the Select Board is approaching the request a little differently. They are putting the traditional amount in their budget, and they're asking voters to vote on whether to support Franklin County Home Health with an additional $3,700 this year. So that'll be on the agenda, the budget itself plus this particular amount. So we're hoping the town of Swanton will support it like they have in the past. I hear nothing but good vibrations from people who, when you talk about Franklin County Home Health, they say, "Oh yeah, so and so received some assistance," and it's just so pleasing to know you live in a community like Swanton that supports health care in the home. And that's important to remember, that this is primarily health care in the home, so that people are not burdened with travel if they're laid up, and there's less disruption of the family. So these are friends and neighbors of all of us, and I think of the day that maybe I might have to use the services of Franklin County Home Health, and I know that I will be well served. So it's a vibrant, necessary part of the community, and so happy to be a part of it.
Well, and I think you raise a good point. You know, we care for all kinds of people, and you know, we hope that if we do serve you, that you know, it's because that's what you need, you know, and perhaps it's a brand new baby, you know, the new baby in a home. So we have joyous moments. So we have people who are recovering from heart attacks or surgery or total joint replacements, or, you know, perhaps going through cancer, as well as taking care of people at the end of life. And I find that personally, as a nurse, very gratifying, having recently had the opportunity to go out and be a real nurse, as my kids would say, making some visits to a hospice patient. So that's been really critical. One of the things that people often ask me is, how do the towns begin to support us? And I also find that fascinating. It kind of goes back to your grandmother's story that, right, you know, the towns took care of each other many, many years ago. Each of the towns had a nurse that they paid, and the nurse gave shots, you know, for $2 or $3, or went out to visit somebody who had just come home from the hospital or had a baby, gave them a bath, kind of checked in on them. So, you know, as times evolved and as Medicare and other insurances began to recognize the value of home health, those town nurses disappeared. But the towns continued to recognize the support that was needed for people to be able to recover in their home. And that's kind of how we have continued that tradition of that. What has surprised you the most, Jen, through your personal experiences and maybe even your work experiences about the value of home care?
I think there's a couple of things. I think, you know, I am always in awe of the staff, which Hank alluded to. People do this work because they have a passion, they have a mission, a personal and professional mission. They have compassion. They want to care for their community, and that really is a common theme when you talk to the staff of your organization or of any of the home health agencies in Vermont. And it's really, that to me is very powerful and very impactful. And so maybe not necessarily a surprise, but something that I guess the surprise element is it's really hard work. It's hard to take care of people in their homes. You have no control over your work environment. You're traveling, as you said, you're traveling in your car, but yet your staff do that day in and day out, and do it with love and compassion and passion. And I think that is really amazing. And again, the depth and breadth of services. I think people may not necessarily understand, like when you said the maternal child, or the end of life, or everything in between. And I think that oftentimes surprises the community when I'm talking to them about why they should support this agency. And that's usually, people are like, oh, I didn't know they did that. And so it's always really gratifying to be able to share that with others.
You know, your comment about the traveling reminds me that this would be a perfect opportunity to give a shout out to all the road crews in Franklin County.
Yes, true, absolutely.
We're taping this in the midst of an ice storm,
Yes.
and you know, we all got here
Yes.
safe and soundly, but you know, we really depend on those road crews to help our staff get to where they need to go.
Absolutely.
We work 365 days
Yes.
a year. We have on-call services, and those road crews help us get where we need to go. You know, they just do phenomenal work. So.
Absolutely.
Great. Thanks for that reminder. Yeah.
Yeah, I was surprised by the teamwork that takes place with patients in their homes. In my case, as a hospice volunteer, I go in for a couple of hours to sit with a patient, and once I arrive, the LPN has been there. The registered nurse might show up even while I'm there, or scheduled to come later in the day. Back at the office, people are monitoring phone calls and keeping track of important messages. It's just such an amazing organization to have this team of people in a given situation who are focusing their care, their compassion to this individual and the family. Hospice work is often a great support to the family who needs a break, who needs a bit of care themselves. And so the team of all these professionals plus the volunteers are out there doing this wonderful work. So.
You know, and you know, I think about technology as being really instrumental and to supporting that teamwork. You know, I don't know how we ever did this work back in 1970. You know, now we have voicemail, we have email. All of our clinicians have a laptop, so we have a complete medical record when we make a visit. So patients should expect and can expect that our staff will know what happened to the visit before, and that's related to technology. We have 31 telemonitors, so we're actually able to monitor patients' blood pressure, their pulse, other kinds of symptoms that we might be monitoring remotely, you know, through a telephone line, and really keep track, very tight track of what's happening with some of the fragilest patients that we take care of. So that technology really helps to support that teamwork and that team effort. And I think everybody brings an important expertise and perspective as part of that teamwork. You know, the volunteers are critical to the work that we do, and as you said, supporting the work that happens in those homes.
Yeah, Janet, I was wondering, you talked about Highgate and Swanton, Fairfield's request and what each of those municipalities has been asked to do. Are there any stories or any particular successes about reaching out to other communities in Franklin County to support the Franklin County Home Health?
We have successes everywhere. So with that, you know, we really do enjoy significant town support. It's about $90,000 in the aggregate. So I'll give out a shout out to my own hometown of Georgia. They have been very supportive through the years, providing us with the request that we have given. And a huge shout out to St. Albans City, who for financial reasons had stopped contributing to all charitable organizations for many, many years. And 3 years ago, after a successful petition process on our part, have now also included that as part of their budgeting process as well. So, you know, as I said earlier, we recognize times are tough everywhere, but we also value that this is viewed as something that makes a difference in the community, makes our Franklin County a better place to live and work.
I did a little math for the town of Swanton, and if my math is right, in the town there were over 8,500 visits which is considerable. 8,500 visits in the town of Swanton, and if you divide that into the requests that we're making, it works out to something like $1.50 per visit. So it's the total may seem daunting, but when you get right down to it, it's a contribution to particular individuals, particular families, our neighbors who are really benefiting from this great service that's being provided in their homes.
Very, very affordable way to look at things.
Yeah, absolutely.
Cheaper than a dozen of eggs.
Yeah,
Right.
and I was thinking the same thing, Hank, that I think it is important for the community members and the residents of each of these towns to know that calculation, there's meaning behind that calculation. It's not just looking at and saying, oh, we're going to ask Swanton for this amount of money. That it's really a really thoughtful process in terms of what are the services that we're providing in that community, what's the community benefit, and then what do we think based on that calculation people will support. And you're right, things are challenging everywhere, but that's part of being a community, is that we support one another. And I think that's really an important message that you bring up around this is really an affordable way to care for your community.
That's right. These are challenging times in healthcare. They certainly are uncertain. We have a new president who has some initiatives underway that we're not quite sure what it's going to mean for us. Certainly state government is undergoing some significant change in its leadership right now, and we'll see how that rolls out. But we're very committed to continuing to do the fabulous work that our organization has been doing for the last almost 40 years. And we're going to just stay as tight as we possibly can to figuring it out and being good partners. I think one of the other things that's really fabulous about our community is how closely we work with other organizations, Northwestern Medical Center, Northwestern Counseling and Support, the United Way, the Adult Day Program. We all work together as a community to really make sure that people are well cared for at home, out and about. So.
It's great.
I know in hospice work, which is the area that I'm most familiar with, it's, as I mentioned earlier, being part of a team, but bringing compassion and presence. We are really present to the patient and to the family, open to their needs, and trying to make sure we understand what their particular needs are, whether it's bedside, holding hands and reading a poem, being present to the patient, but as well being present for the family and making sure they know there's a team of professionals behind them supporting them in this particular time of life, the end of life. And so it's very gratifying to be part of that process.
So some of the audience might be thinking, that might be kind of scary to be a hospice volunteer, going in someplace that I haven't been before, meeting a new individual, a new family, and I'm not exactly sure what to do. Can you talk a little bit about how our organization supports our volunteers?
Yeah, when I first went into hospice volunteering, I too had that kind of fear that, well, what am I getting into here? But once I took the training is comprised of 10 evening sessions over 10 weeks, bedside manner, how to be aware of needs, and some nursing, but the surprise to me was that I've done very little nursing type of things. That the LPN has been there earlier than my arrival. I think the idea, the reward is what's amazing to me. That I've done nothing more rewarding than being part of a team that works so beautifully with patients at their end of life. And it's a typical visit might include playing checkers, or gin rummy, or reading a book, reading poetry. If the patient reaches a point where they're not aware enough to be doing that sort of thing, you comfort them, you hold their hand, you might hum a song, turn on their favorite radio station. There's a little network in the Burlington area that has a group of a cappella singers that come, and I'm hoping that we could probably get that going up here someday too.
That would be wonderful. That would be wonderful.
But it's all about supporting the family, supporting the patient, and it's very rewarding. Yeah.
It really is. It's a privilege to be with someone at the end of their life.
Yeah.
It truly is a privilege.
Well, and I think that the scary part for some people, volunteers, and I can certainly say from my own experience, family members, is it's really not, the purpose of hospice and end-of-life care is not really about the death. It's really about the life until that point, and giving somebody the most amazing life that they can have in the time that they have left. And I think that's really important. The other thing that I also wanted to mention that I don't know that we've really touched on is the impact that this organization has. You know, we've talked about home health, we've talked about maternal child health, end of life, but there are also programs and services so that community members can stay in place and don't have to go to a nursing home. And I think, and there are, I don't know how many caregivers you have doing that work currently, but there are hundreds of caregivers or close to that who are going into homes every day and helping with cooking and cleaning and those kinds of daily supports so that loved ones can work, but yet their elderly or disabled loved ones can stay at home. And I think that's very impactful to the community as well, because otherwise those people would be in nursing homes.
That's so, so true. So I just really want to start to wrap things up, and thank you so much for your time and your support and your advocacy. You know, as I said earlier, we have town meeting days coming up, and your vote counts. And you know, I encourage you to, and all of the audience, to get out and vote, spread the good word about what we do to continue to support our organization. If you have questions or would like some assistance for yourself or your loved one, please call us at 527-7531. And thank you again for your support.